once again, I am Azil Ann P and I will be performing or demonstrating the assessment of the head, the neck, as well as the eyes, the nose, the ears, and the mouth. So in this video, it is already the combination of the two. So the first step is always to identify your patient either through their wristband or the bed tap. But if there is no wristband or bed tap, then we can just directly ask the patient to state their name. Then next, introduce yourself, explain the procedure, and answer if there are any questions from the patient. So for example, hi ma'am, I am Azil Ann P and I am your nurse for today from 7 a.m. to 7 p.m. So may I ask you to please state your name? Okay, so Miss Danielle, we will be assessing your head, your neck, your eyes, your nose, your ears, and your mouth. And this is a very important examination because it plays an integral part in your overall health, and it will help us to identify and determine any underlying problems or complications regarding your health. So if you don't have any questions anymore, if it's already clear to you, then shall we proceed to the next step?
Yes, ma'am.
Okay. So the next step in the checklist is to perform hand hygiene and wear your gloves. But I have thought that I should provide privacy first by closing the door and closing the curtains, because if I will use my gloves now and perform hand hygiene, there will be chances that I will contaminate my hands and the gloves. So let's close the curtain first and then the doors. And now perform hand hygiene. And wear clean gloves. Now, the next thing that we will do is to assess the scalp, and the hair of the patient. So in doing that, you should observe the scalp of the patient for its size, the shape, and the contour. So as of what I can see, it is rounded, it is symmetrical, and it seems smooth, and it doesn't have any nodules or masses, meaning it's normocephalic, so it's normal. And next is to observe for the scalp of the patient in several areas. And in doing that, you should ask the patient or inquire her if she has any injuries. So ma'am, do you have any injuries? Okay, so she doesn't have any injuries. And then note as well if she has lice, nits, dandruff, or lesions. So she's negative for nits, lice, dandruff, and lesions. And now the next thing that we will do is to palpate the head of the patient. And in doing that, you should ask the patient if she feels tenderness. So, ma'am, do you feel pain as I palpate your head? Okay, so she doesn't feel tenderness when I palpate her head. And now next is to observe and feel the hair condition of the patient. And as of what I have observed, it is shiny, it is evenly distributed, and it looks black with the combination of brown. So now, the next thing that we will assess is the face of the patient. In doing that, may I ask you, ma'am, to please remove your face mask? Okay, thank you. So now, let's observe for the shape of the face. And as of what I have observed, it's rounded. And now let's inspect for the symmetry. In doing that, you should check for the palpebral fissure of the patient, as well as the bilateral nasolabial fold of the patient. So for the palpebral fissure of the patient, the distance between the eyelids should be equal for both of the eyes. And as of what I can see, it's equal for both of the eyes. And now, ma'am, may I ask you to please smile? So there I can see folds between or in the corners of the nose of the patient and in the corners of her mouth, and meaning there is the presence of the nasolabial fold of the patient. So since we have the palpebral fissure of the patient as well as the bilateral nasolabial fold, the face of the patient is symmetrical. Now the next thing that we will do is to assess for the sensory function of the trigeminal or cranial nerve 5 of the patient. So in doing that, you should ask your patient to Ma'am, can you please close your eyes? And then, with the use of cotton wisp, you will roll it over the forehead of the patient, in the cheeks, as well as in the jaws of the patient. So you should do it in both sides. And then, ask the patient if she feels it, and ask her to point where does she feel it. So ma'am, please point where you feel it, and if you can feel it. Okay, so next. Okay, next. So you can now open your eyes, ma'am. And the next thing that we have to check is the corneal reflex of the patient, wherein we will use again another cotton wisp and roll it over here. So the normal response of the patient is blinking, and the patient blinked, meaning it's normal. Now for the motor function of the patient, let's ask the patient to chew and then clench your jaw. So I can see that there is strength and force when she did that, meaning it's normal. Now the next thing that we will do is to assess the patient's facial sensory function by asking her to, again, close your eyes, ma'am. And then, ma'am, can you please stick out your tongue? And we will put something there. And, okay, ma'am, move your tongue inward. So, can you taste it?
Yes, ma'am.
What's the taste, ma'am?
Sweet.
Okay, so she was able to taste it, meaning it's normal. You can now open your eyes. And the next thing that she will do is to assess for the motor function of the patient by asking her to, ma'am, can you please smile? Frown. And then raise your eyebrows. Close your eyelids. Now, whistle. Whistle. You can open your eyes, ma'am. Whistle, ma'am. And then, puff your cheeks. Yes, like that. Okay, so she was able to do that, meaning everything is normal. Now, the next thing that we will assess is the inspection of the eyebrows, the eyes, and the eyelashes. So, in doing that, let's look at it. So, the eyebrows are in line with each other. It's symmetrical. It's evenly distributed. And the color is black, just like the hair. And we should remember that it depends upon the race. So, now, next is the eyes. It's in place, it's symmetrical, it's in line with each other, it's non-protruding, and the palpebral fissure is equal. And for the eyelashes, it's evenly distributed, and the color is the same with the eyebrows and the hair, which is black, and it is turned outward. So everything is normal in that part. Now, the next thing that we will assess is the eyelids and the lacrimal apparatus of the patient. So, for the eyelids, in inspecting it, you should check for the position and the symmetry. So, as of what I can see, it's symmetrical and it's in place. And now, for the palpation of the eyelids, for the lacrimal glands, with the use of the pads of the index finger, let's slide it gently against the upper orbital rim of the patient. So, look down, ma'am. And then ask the patient if she feels tenderness. So, do you feel pain, ma'am, as I do this? Okay, so it's normal. And the next is to palpate for the lacrimal ducts of the patient with the use of the pads of the index finger once again. And then press it gently against the lower inner orbital rim of the patient. But make sure that it is not against the nose. And the next thing that we will assess is the conjunctiva of the patient by separating the eyelids of the patient. So, ma'am, look at me. And then ask her to look up, look down, side, and the other side. So, now the other eye. Look up, look down, the other side, and then the other side. Okay, so it is transparent and a few capillaries are visible. Now for the palpebral conjunctiva, let's ask the patient to look down with the eyes slightly open. Now, with the use of cotton tip applicator, let's grasp the upper eyelashes of the patient. Then pull it gently downward. Then push the cotton tip applicator above the lid margin of the patient gently. Now, then ask the patient to look up, then blink. So that way, it will go back to its normal position immediately. And I have seen that it doesn't have any swelling, it doesn't have any infections or foreign objects, and it appeared shiny, pinkish, and smooth. So for the sclera, I have already assessed it a while back while assessing the conjunctiva, and it appeared white. Now for the assessment of the cornea, the anterior chamber, and the iris of the patient, let's use this pen light and place it directly oblique to the patient. So ma'am, can you please look at this? Okay, so the cornea appeared shiny, transparent, and smooth, while the iris, its details were visible, and it was flat. Now for the assessment of the pupils, we include here the size and the shape, and as well as the reaction to light. So we remember that I've already assessed for the cornea, the anterior chamber, and the iris of the patient using this pen light, and at that time I've already assessed for the pupils of the patient. And I was able to observe for the direct responsive constriction, and the pupils appeared black and equal in size. So now, let's ask the patient to stare at this object and fix, ma'am, please fix your gaze on my index finger, which is placed, it should be placed 5 inches away from the nose of the patient. And as we move it away from the patient, the papillary dilates, and as we move it near the patient, the papillary constricts. Now, let's assess the cranial nerve 2 of the patient, or the optic nerve of the patient, by testing the visual acuity of the patient using this Snellen's chart, or for illiterate people, we will use the illiterate E chart. Ask the patient to move 20 feet away from the Snellen's chart, and make sure that you only test one eye at a time. Now, ask the client to cover the other eye with an opaque card or eye cover, and make sure that she doesn't use her fingers in doing that. So ma'am, please cover your other eye. Now ask the client to read the chart by pointing out the letter randomly. It could be from the largest to smallest or vice versa. So ma'am, please read this.
E, B, F, O, P, C, P.
Now the other eye. Please cover your other eye.
P, E.
Now let's assess the peripheral vision or the visual fields of the client. So in this part, the client and the examiner should be sitting or standing in opposite direction with the eyes on the same horizontal level, and the distance should be 1.5 or 2 feet apart. And now, with an opaque card, I will ask the patient to cover her right eye. And at the same time, I will also cover my eye, which is opposite to the covered eye of the patient. So, we will do it like this. And then, the eyes which are uncovered should look at each other or stare at each other just like an eye to eye. And then, with this pen light, with this object, I will move it in the periphery in both directions, hexagonally or horizontally, and from above and below. And then, the client should see it the same time the examiner sees it. But, instead of using the pen light, I will just ask the client if how many fingers does she see am I raising. So, for example, ma'am, how many fingers do you see?
One.
How about this?
2,
Okay, so the other eye. Please cover your other eye. Now, ma'am, how many fingers do you see?
1,
How about this?
5.
So, for the next part of the assessment, we will remain in this position because we will be also assessing the cranial nerve 3, 4, and 6 of the client. And in this part, we have to be in a distance of 1.5 and 2 feet apart as well. And with the use of this object, the client will follow the movement of the pen light as I move it in a clockwise direction hexagonally. And the client should follow the object with her eyes without moving her neck. You should note as well for any jerky movements in the eye of the patient. So, ma'am, follow this object with your eyes only without moving your neck. Okay, so now. Now, let's proceed to the assessment of the ears. So, in here, we will first inspect for the auricles of the patient. We will inspect for the size, the position, parallelism, the appearance, and the color. And the next, we will palpate for the auricles and the mastoid process. And then we will also palpate for tenderness or firmness in the cartilage of the auricles, as well as the tenderness in the mastoid process and the auricles of the patient. The next, we will inspect for the ear canal of the patient. So, ma'am, can you please turn around? We will inspect for the ear canal of the patient for any presence of discharges, cerumen, the color as well. We will also inspect that and any foreign bodies that are present there. So in doing that for adults, we will pull the pinna of the patient upward so that we could straighten the ear canal of the patient. Now, the next thing that we have to do in the assessment of the ears is to perform otoscopic examination of the tympanic membrane so that we could check for the color and the landmarks. But since we don't have otoscope, then let's just skip that part for the meantime. Now, let's proceed to the assessment of the nose. So, as you can see, I asked my client to lie in a supine position with her head elevated just a little so that we could easily navigate the body part of the client. So, the first thing that we have to do here is to check for the placement and symmetry, as well as the presence of any discharges and the flaring of the alae nasi. And then, next is to check for the patency of the nares. So in doing that, let's occlude one nostril at a time and inquire for any difficulty of breathing. So ma'am, I will occlude one of your nostrils. So, is it difficult for you to breathe if I do this? Okay, so how about the other nostril? Okay, so now let's proceed to the next step, which is to check as well for the external nares by palpating it so that we could check for displacement of the cartilage and bones, as well as for the tenderness and masses. Okay, next is to check as well for the internal nares by asking the client to hyperextend their neck. So ma'am, can you please do it? And then with the use of our hands, the forefingers over the forehead of the client, and the thumb pushing the tip of the nose gently. And with the use of a pen light, let's shine a light in the nares of the client. So now, the next thing that we have to do is to inspect as well for the septum of the client, for its perforation and position, as well as the nasal mucosa for swelling, exudates, and the color. We will also check for the sinuses of the client, the paranasal sinuses of the client, by palpating the cheeks. And lastly is to check the cranial nerve 1 of the client or the olfactory nerve of the client by asking the client to please, ma'am, can you please sit down? And then ask the client to close her eyes. Let's check the sense of smell of the client if she will be able to identify the substance that I will place near her. So now let's occlude one nostril at a time. So ma'am, tell me what substance is this?
Alcohol.
Okay, so she was able to identify that it was an alcohol. And now the other one, the other nostril. How about this?
Vinegar.
Okay, so she was able to identify that it was vinegar. Okay, so thank you, ma'am. You can now open your eyes. Now let's proceed to the assessment of the mouth and the oropharynx lips. So the first thing that we have to do here is to inspect for the color, the symmetry, and for edema. And then you should also palpate for temporomandibular. But now let's proceed to the gums of the patient. So ask your patient to say E.
E.
And make sure that the gums is visible. So check for the color and if there are bleeding. Can you please also say A.
A.
So, okay, thank you, ma'am. There is no bleeding and the color is good. It's pinkish. And now let's proceed to her teeth. So you should note for the number as well as for the color. Check if there are dental caries or fillings. And you should also check for the odor. So ma'am, can you please say A?
A.
Okay, so there is no dental caries or fillings and the odor in color is good. So now, let's proceed to the tongue of the patient. So you should note for the texture, the color, if there are lesions, as well as the gum reflex and the movement. And then you should also check for the frenulum placement. So ma'am, can you please stick out your tongue? Can you move it upward? Side? The other side? Okay, so there you go. It's all good. And now let's proceed to the assessment of the uvula. So in the assessment of the uvula, note for the position and the color. And then you should also check for the cranial nerve 10, which is the vagus nerve. And in doing that, you should ask the client to say "ah," and when she does that, it should move upward and forward. So ma'am, can you please say "ah"
A.
again?
A.
Now let's proceed to the assessment of the neck. So the first thing that we have to do here is to palpate the forehead, as well as the posterior triangle and the posterior cervical lymph nodes of the client using the finger pads in a slow and circular motion. So now let's inspect and palpate in front and behind the ears of the client. Under the chin. As well as the anterior triangle and the anterior cervical lymph nodes. Now let's inspect and palpate the carotid arteries of the client. You should do it in both sides, the left and the right, and make sure that you should only palpate one carotid at a time so that we could not compromise the arterial flow to the brain. And now let's do it. Please. The other side. Now, in auscultating the carotid arteries, let's use the bell of the stethoscope. But since my stethoscope doesn't have a bell, let's use the diaphragm for the meantime. And make sure that you note for any burns. Now let's inspect and palpate the trachea of the client. With the use of our 4 fingers, let's place it here. So make sure that the spaces are equal for both sides. Now let's let's also inspect and palpate for the thyroid gland of the client by asking the client to please extend their neck and swallow. Then palpate. Now, if the thyroid glands are enlarged, you should also auscultate it with the use of the bell of the stethoscope. Now, let's also inspect and palpate for the supraclavicular area of the client. And then, we should also assess for the movement of the neck of the client. So, let's ask the client to move her chin to her chest. Now, move your chin to your shoulders. Then, move here. Here first, then move here. And then, move the ears to the shoulder, to the other side. Now, move the tip of the head to the back as far as possible. Okay, so there you go. Thank you, ma'am. So now we're down to the last step, which is to perform hand hygiene. Dispose your gloves. And you should always document everything that you will do for your client. So that's it. Thank you.